Good evening, everybody. The topic today I am going to discuss is the blood clotting mechanism or hemostasis. So, hemostasis, the primary requirements. These are the learning objectives. We are going to define what is hemostasis and what are the major steps in hemostasis. Appreciate the principle of temporary hemostasis. Understand the role of platelets in temporary hemostatic flow. List of step of thrombopoiesis. Thrombopoiesis is the origin, development, and maturation of platelets from the pluripotent stem cell, that is thrombopoiesis. So the cytoskeleton systems and the granules and the structure of platelet. And lastly, we are going to discuss about what are the properties of platelet. So hemostasis, what we can define is hemo means blood. Stasis means stoppage of bleeding or arrest of bleeding while maintaining blood in fluid state within the vascular system. So hemostasis mechanism by which the loss of blood from vascular system is prevented by complex interaction of vessel wall, platelets and plasma proteins. So in the blood clotting process, the three basic requirements are the platelets. Number one is a platelet. The normal count of platelet is 1.4 to 1.5 to 4 lakhs cells per millimeter cube of blood. And then the second important component for the blood clotting is calcium in a free form of calcium, that is Ca2 plus ion. The third important component is the clotting factors. 1 to 13 clotting factors are there. So these three are the primary requirements for the blood clotting. And this happens broadly in two stages, the primary and secondary. What is the primary hemostasis? Initial stage during vascular wall and platelet interact to limit the blood loss from damaged vessels. This is called temporary hemostasis. The secondary hemostasis is the clotting. So it takes place with the help of the clotting factors by enzymatic cascading reactions, and this is also called definitive hemostasis. Secondary hemostasis occur when at the site of injury of the injury or damage to the blood vessel. So these are the major steps in the hemostasis. The first one is the vasoconstriction. Vaso means blood vessel. So narrowing of the diameter of a blood vessel or decreasing the diameter of a blood vessel, thereby it prevents the loss of blood from the blood vessel. That is the vasoconstriction. The second one, temporary hemostatic plaque formation. This is the second step, and third one is the complete clotting of the blood by forming the fibrin thread. So in this flowchart, what we are going to explain is about the hemostasis. The first one, so if there is any injury or any trauma or any damage to the blood vessel, that is the vascular injury. Inside the blood vessel is lined by three different layers like tunica media, tunica intima, and tunica adventitia. And inside there is endothelium, which is made up of a collagen. When the collagen is exposed, immediately there is the mechanical vasoconstriction takes place, decreasing the diameter of a blood vessel. And the third step is a very important factor which starts which initiates the blood clotting mechanism is tissue thromboplastin. This tissue thromboplastin is the clotting factor 3, which activates the blood clotting mechanism. So after there is the collagen exposure, we can see there are so many platelets which are wandering in the blood, in the blood circulatory system. All these the platelets, whenever there occurs an injury to the blood vessel, these platelets they come near to the site of injury, and that property is called as a platelet aggregation. And then coming to the platelet activation, aggregated platelets at the site of injury, they release a very important uh, hormone called as a serotonin, which is a chemical vasoconstrictor. Which is a chemical vasoconstrictor. Vasoconstriction means decreasing the size of the blood vessel is called vasoconstriction. And next, it initiates a temporary hemostasis. So this is the general sequential steps in the hemostasis. So what is vasoconstriction? Constriction of vascular smooth muscle in response to injury is called vasoconstriction. It is a mechanical response, and a very important neurotransmitter plays a very important role in the vasoconstrictor mechanism is a serotonin, which is called as a happy hormone or a lovely hormone. So the formation of a platelet plug at the site of injury is called temporary hemostatic plug. So coming to the blood clotting mechanism, this immediately following injury, the clotting mechanism of blood is initiated. This results in the formation of blood clot at the site of injury. The formation of blood clot occurs in and around the platelet plug. It is called nephritic hemostatic plug or secondary. We can call it as the fibril formation of fibrin thread. See, this is the endothelial cell, this is the blood vessel, and there is a damage to the blood vessel, and the inner wall of the blood vessel is lined with collagen, and the very inner wall is lined with endothelium. Whenever there is an exposure, there is a von Willebrand's factor, and all the platelets they come and they pack aggregate near the injured blood vessel, and they form. There are two types of granules in the platelets: alpha granules and dense granules. They secrete all the platelets. They come and aggregate and they secrete serotonin. And this particular serotonin, it is a powerful vasoconstrictor. By decreasing the diameter of the blood vessel, you can prevent the excessive bleeding of the blood from the injured blood vessel. Thrombopoiesis. What is thrombopoiesis? We can define thrombopoiesis as origin, development, and maturation of platelets from the pluripotent stem cell or the giant cells in the bone marrow. So this is the flowchart that what we are going to explain. The different steps in the development, origin, development, and maturation of platelets. All the blood cells, all the three blood cells, red blood cells, white blood cells, and platelets, they take origin from the pluripotent stem cell, and from the pluripotent stem cell, you can see the second stage is a committed stem cell, and from that the third stage colony forming unit megakaryocyte, and from there we have the megakaryoblast, pro-megakaryoblast, and lastly we can see the mature megakaryoblast and the mature platelet. So these are all the different stages in the development of platelets. Coming to the structure of a platelet, we cannot see or we cannot explain there is a regular shape. This platelet is having irregular shape, having a dense, having a very important connecting system called as a canalicular system or canaliculi, which there is always contact with the extracellular fluid extracellularly in the platelet. And we have four types of granules: alpha granules, dense granules, and lysosomal granules, and myeloperoxidase granules. So there is a nucleus is very reduced in size. The megakaryocytes increase in size. Number and ploidy. Opposite effects occur with the demand decreases. So decrease in the platelet count is called thrombocytopenia. Increase in the platelet is called thrombocytosis. So you can see the hemopoietic stem cell, the megakaryocyte, and lastly these pink colored granular cells are called as the platelets. Then what is thrombopoietin? Thrombopoietin, endogenous thrombopoietin is a short-lived polypeptide produced by the liver which plays a very important role in the synthesis of platelets. Interleukin 1, interleukin 3, 6, 11, they stimulate platelets. So interleukins are the a very important biochemical substances which are produced by the liver. So the maximum lifespan of each platelet is 8 to 12 days. And these platelets, after completing the lifespan, they go and destroy the reticuloendothelial system, and that is the spleen. So this is a typical structure of a platelet. So there are two types of granules, a very important granules known as alpha granules and dense granules. So dense granules, we have the growth, a very important factor called as a PDGF, that is a platelet derived growth factor. It plays a very important role in the repair of the damaged tissues in the body. It is a potent mitogen. It is a PDGF. So these are the contents of alpha granules and dense granules. Alpha granules secrete von Willebrand's factor. It is a very important factor, thrombospondin, PDGF. That PDGF is a potent mitogen which plays a very important role in the tissue repair after trauma to a tissue. It is a platelet activating factor, fibronectin, plasminogen, platelet fibrinogen, porcellin, alpha 2 plasma inhibitors, coagulation factor 5, and coagulation factor 11. That is plasma thromboplastin antioxidant and tissue plasma plasminogen activator. All these are the different contents of alpha granules. Among these contents, the PDGF is a very important content. Then coming to the dense granules, these dense granules they contain a very important neurotransmitter that is called serotonin, which plays a very important role in the blood clotting mechanism by decreasing the size of the blood vessel, that is vasoconstriction, by preventing the huge loss of blood from the blood vessel, damaged blood vessel. Next, there are three important properties for the platelets, that is cell adhesion, aggregation, and activation. So there you can see this is the platelet aggregation and activation. Next, what are the functions of platelets? Temporary hemostasis, the blood clotting, and clot retraction. Thrombolysis, it is means the dissolution of blood clot. Phagocytosis, the killing up of the foreign bodies is called phagocytosis. Storage and transport, these platelets synthesize very important substances. Vascular growth is nothing but repair of a damaged tissue, that is a platelet derived growth factor. I told in the beginning of the class that is a normal count of the platelet, it is 1.5 to 4 lakhs per millimeter cube of blood. And thrombocytopenia, you can see in the viral infections like dengue and severe viral infections like chickenpox. Thrombocytosis is a polycythemia vera, chronic myeloid leukemia in iron deficiency anemia, removal of spleen, that is splenectomy, chronic infection, surgeons, myeloid leukemia is a cancer where you can find increased count of platelets more than normal count. So that's regarding the hemostasis. Thank you. Must be